Jonathan Coleman.
Mr. Speaker, every time I hear Mr. Little speak, I'm thoroughly reminded of why he couldn't win the New Plymouth electorate 2 elections in a row. And I tell you, there's one thing that unites the Labor caucus. It's the overriding feeling of boredom they get whenever they see their leader get up to speak. He was talking about arrogant and contemptuous. You want to hear it?
Order. Calm down.
He was talking about arrogant and contemptuous. What none of the Labor caucus could see, Mr. Speaker, was right throughout that speech, Phil Goff and David Cunliffe were talking amongst themselves in the back row because they've given up so much hope in Andrew Little, they couldn't even be bothered listening to their leader speak. And I've got a number of messages for Annette King, actually. But I tell you, Mr. Speaker, if she's going to let that doofus take over her seat at the general election, she's going to end up with some
The Honourable Annette King.
You, Mr. Speaker, you heard what the member just said, a disgraceful comment about the Leader of the Opposition. If he can't argue the issues, he shouldn't get on his feet at all. That's right.
Point is taken, the Minister will restrict himself to parliamentary language and terms of address.
Well, that was a very easy wind-up. You can see Mrs. King gets very head up very quickly. Look, there are quite a few things which we just need to clarify about this whole situation. And I can tell you can tell when Labor are on the ropes because they won't listen, OK? Now, the first thing I'd like to say, if this is the biggest issue that Labor have got to campaign on today, I tell you, they are in real trouble. And it's very interesting that they don't want to be in here and talk about the funding of melanoma drugs because actually they've put themselves in a terrible position over that. They're compromised with their contacts with drug companies over that. It's very interesting that they don't want to talk about the economy because, as they know, they're losing on the economy, so try health. That's the strategy over there. But look, now, you'll really like this bit. So just listen up. The Ministry of Health, listen, you'll like this. You might even want to quote it back.
Just to quote previous Speaker Hunt, interjections are to be rare and reasonable and hopefully witty. Yep. Just repeating the same line over and over and over again is not within standing orders. No, don't crank up the volume, as my cousin would encourage you to do. Just see if you can limit yourself to what's rare, reasonable and hopefully witty.
Come on, Mr. Speaker, it's not all about you, you know. Anyway.
You can't make comments like that. You'll withdraw and apologise.
Now, Labor...
You'll withdraw and apologise.
I withdraw and apologise, Mr. Speaker. Now, look, listen up. You will like this bit, OK? Just listen to this. The Ministry of Health made a mistake. I'll say it again. The Ministry of Health made a mistake, right? So... Their financial governance in this matter, and they've admitted it themselves, it wasn't up to standard, OK? So they said that they could fund this move out of cash reserves, and when it came down to it, actually, they were $18 million short. And that was completely unacceptable. And Chai Chua has taken responsibility for that on behalf of the ministry. I've made it very clear to him that that cannot happen again. But you want to look at the wider context here. So what this move is about, it's about 5 large government departments, health, education, MSD, Crown Law and MB, all moving into new premises. And that is going to constrict the footprint by 30% over the next 20 years. It's going to cut costs by 20% and it's going to save $338 million. So it was a very good decision to make. Absolutely a great example of better public services. The financing of it, there was a mistake there. But I can tell you, the wider story is very, very good news. But I can tell you, there's a few things that Mr. Little said there that were completely incorrect, and I'm not surprised about that. Because the fact is, this is being funded out of departmental expenditure, right? So it's the back office expenditure of the Ministry of Health. And the very good news, and once again, Mr. Speaker, you can tell these guys, they don't want to hear because they know they're being delivered knockout punches on this stuff. When they were in government, they were spending $230 million just on running the ministry, not on delivering clinical services, $230 million. Today, that ministry costs $190 million to run. There used to be 1,500 people there. There are now 1,100. And guess what? They're producing better results all the time. So we're not in a situation like when Mrs. King was the minister, where she put in an extra $2 billion and produced 2,000, and I've got to fold a few here for the King file, 2,000 fewer operations. It was absolutely incredible. In fact, we were talking about first specialist assessments today, Mr. Speaker. You know, when Annette King was the minister, when she started, they were doing 38,000 specialist appointments in Auckland DHB each year. When she finished, they were doing 7,000 fewer. So how could you spend 6 years as the minister and deliver 7,000 fewer appointments? But it was worse than that in other places. Well, actually not quite as bad, that was the worst. In Canterbury, she ended up over 6 years delivering 1,800 fewer appointments. And here in Wellington, Mr. Speaker, where she is an MP, by the end of 6 years, she was delivering almost 5,000 fewer appointments. Yeah. And I think what it shows, Mr. Speaker, is the dearth of talent in the Labor benches. Because what are they going to do when Mrs. King leaves, Mr. Speaker? They are absolutely stuffed. They couldn't have the MP for Wigram there. She's not up to it. Kelvin Davis, pretty good footballer, but not much good for anything else. Ian Lees-Galloway, they're never going to have a King's College old boy on the front bench. Universally despised outside Parliament, inside Parliament, outside the caucus and inside the caucus. So the cupboard's pretty bare over there. There might be a bit of hope for that guy from North Dunedin, but remember, he's the guy who wants to ban Google.
Order. I'm sorry to interrupt the Minister, but he needs to remember, sit down when I'm on my feet, thank you, Minister. He needs to remember this is not a general debate, it's a specific debate, an urgent debate, and he needs to address it. And if he hasn't got anything more to say about it, he doesn't need to fill his whole 15 minutes.
Yes, I do. Look, I've got plenty to say, Mr. Speaker, because actually I'm responding to the character assassination of the Minister of Finance and the scurrilous attacks on me by just pointing out a few things about their pedigree. Now, Andrew Little, listen to this. Andrew Little was talking about Dunedin. He was talking about Dunedin. He was saying the sick and the elderly would suffer there. He was saying people would not get their operations there. Well, that is absolutely untrue, because actually the point is this $24 million is actually money well spent. It's going to save money in the long term. It doesn't come out of the operational budget, right? So it doesn't take $1 away from patient services. So actually, anyone who's saying that, like Trevor Mallard, the time-expired member for Lower Hutt, they're wrong. They're wrong. And I can tell you, if Labor members did a bit more work, if they got around the sector, if they did some reading, if they produced some discussion documents, they might know some facts about the health sector. Because in actual fact, we are delivering more and better services all the time. I know they read a few press releases. They would have been bitterly disappointed, Mr. Speaker, to see that actually over our time in government, we have produced an extra 110,000 appointments per year. So it's gone from 430,000 appointments per year to 540,000 appointments a year. And this is going to be Labor's big knockout punch, because they were sure that when it came to GP referrals to specialists, they were going to be able to say that it's absolutely terrible, no one's getting their referrals. But you know what the data shows? It shows that 90% of patients referred from a GP to a hospital specialist in the 3-month period of the first data release last year, 90% got an appointment with a specialist. And I know that's very, very disappointing to government critics, to haters and wreckers of the health system, to Mrs. King and to the Labor Party. But that's the fact. Because what's happening under this government, Mr. Speaker, is we are putting more and more frontline services available to the public all the time. The other thing that I need to absolutely raise here is Labor keep on stating, and it's completely untrue, for the record, it is incorrect, that $1.7 billion has been cut from the health budget. That is untrue and it's a lie. I don't know why they keep on saying it. It's completely untrue. Because actual fact, the health budget goes up every year. It went up $400 million last year. It's gone up $4 billion over our time in government. So what was happening with Labor, they were increasing the spend like crazy. It was going up 7 to 8% per year. And I can tell you, if we had continued on that spending track, the government would now be running the books at a massive deficit. So the question that Labor needs to actually answer is how can they promise more and more money into health and also explain how they'll keep the books in balance? And I can tell you, Grant Robertson can't do it. He absolutely can't, because it's impossible. Because the fact is, when they were in charge of the health system, they put more and more money in and they delivered less and less. That's all you need to remember at home. When Labor's managing health, they spend more and they produce less. And I can remember at North Shore Hospital, I would go there, there'd be people waiting under the harsh fluorescent lights, there'd be queues of ambulances in the car park, and people were saying, we've got to get National in, because quite frankly, we had Annette King, we've had Pete Hodson, we've had the disaster of David Cunliffe. We cannot bear to have the health system run by these people any longer. The other thing that I'd like to say is the health targets have been a massive success, and I know Labor would concede that they have, because when Labor were running the health system, about 65% of our kids got immunised at the age of 8 months. Now, it's 95%. It's absolutely incredible. When Labor were running it, there were fewer elective surgeries delivered over their time in government. We've promised an uplift of 4,000 per year, and we've delivered an extra 50,000 surgeries per annum, greater than when we came into government. An extra 110,000 specialist appointments, 5,500 more doctors and nurses in the system. You know, when Annette King was there, she was sending 800 people per year to Australia for basic cancer care. 800 people. You know how many go now? Zero. So there's no question that people are getting better health care under this government. And Annette King speaks about cover-ups. Well, I'll tell you what a cover-up is. It's sitting in the room when the decision is made to spend $800,000 of taxpayer money on your election pledge card. It's kicking 30,000 people off wait lists, and it's sending people off to Australia for cancer care. So I think Mrs King has thoroughly proved the case for her incompetence. It's sad, actually, that she's blocking up the Rongotai electorate. I think she'd be far better going off to local government, but actually, on reflection, there's no one competent in the Labor Party to take over the portfolio, so they're probably better to leave her there for the moment. But, you know, when you come back to it, we have put more frontline services there for New Zealanders. If these guys ever get in government, they'll spend more and more, they'll produce less and less, and you know what? They'll continue to go around the country misleading the public. You know what Annette King said on TPP? She said people would die. She said TPP would kill people. She said it would cost hundreds of millions of dollars, and she's been proven wrong, and now she's raising a debating point.
Annette King.
Speaker, I require him to withdraw that. I have never said TPP would kill people. That's a total lie.
It's a matter for debate.
Well, it's a lie.
But it is
anyway, while Annette King was saying TPP would kill people, secretly she wants to vote for it, and that's the big problem they've got. You know, apart from hardline left-winger Marxist Grant Robertson, there's a whole lot of people who want to vote for it. Just like David Shearer wants to vote for the flag. So, you know, there's so much to debate in this parliament. I'm amazed that Labor is wasting the parliament's time with an urgent debate on a minor financial blip.
I'll remind the Minister again that this is not a general debate. It is an urgent debate around the question that was raised. The member should confine himself to that.
Yep. Well, going back to that question, I can tell you this move by the Ministry of Health into new premises is an excellent move. It'll reduce costs by 20%, the footprint by 30%, and that will save $338 million over 20 years. But I can tell you, Labor would not have a clue how to do anything more efficiently, how to produce better services. And I can tell you, Mr. Speaker, I can tell the Speaker that the constant commitment of this government is more frontline health services for New Zealanders. So that's more operations, it's more cancer care, it's more doctors and nurses, it's more immunisations. And the bottom line is, only National can manage the books and produce better health services for New Zealanders. And the public know that, Mr. Speaker.
Mr. Speaker.